Good afternoon, everyone. My name is Cassie Hopkins, and I help coordinate the webinars for Hausman Johnson Insurance and the Benefit Services Group. I would like to welcome you to today's webinar, Preparing Your Business for Reopening After the COVID Shelter at Home, presented by Rick Barton and Jeff Dutton from Hausman Johnson Insurance and the Benefit Services Group. This webinar will be interactive and will feature a question and answer session where you can type a question in during the webinar, and Rick or Jeff will address it during our question and answer session. After the webinar is over, there will be a short survey we're hoping you can fill out for us to give us feedback on the webinar and the presenters, and if there's any webinar topics you'd like us to go over. This webinar will be recorded and will be available on the webinar archive section of our website. Each attendee will receive a follow-up email with a link to the recording and the presentation slides. I would now like to introduce you to our speakers, Rick Barton and Jeff Dutton. Rick has over 20 years of experience in safety and risk control, working with clients in many industries, including construction, mining, trucking, manufacturing, and hospitality. He specializes in assessing risk for the clients of Hausman Johnson Insurance to reduce loss potential. Through safety assessments and loss analysis, Rick develops solutions which include safety management techniques, training, and engineering. Additionally, he has been asked to speak at local and national safety conferences on topics such as how to manage safety on a job site and what it takes to be a safety leader. Jeff Dutton joined the Hausman Johnson safety team in 2020 and brings a wealth of experience in construction and safety manufacturing to his role. Prior to joining Hausman Johnson, he was the safety director for H&H Group Holdings in Madison. Jeff's passion for safety is tangible. He likes to think outside the box to help his clients develop strategic safety programs and to ultimately keep their employees safe. Welcome, Rick and Jeff.
Well, good afternoon, everybody. How are you this afternoon? Well, we're going to get into preparing your business for reopening. This is perfect timing with things that have gone on just recently, and we're going to get into some topics. We're going to get into this topic and give you some information on how you should proceed. Okay, we want to get back to the new normal, but what is the new normal? Everybody's looking to get back to work, but they don't know what to expect. Is it going to be back to the way things used to be? More than likely not. It's going to be something different. We have to be able to adapt to the way things are now. Like if we're going to a grocery store, some grocery stores won't allow you to go in there without having a mask on, but it's going to be something we have to adapt to, and how we're going to function with our new normal. It's going to take some getting used to, but I think that we can be resilient and we can adapt to what we need to adapt to. But first, we have to do our due diligence. We have to know what we need to do to protect our employees, what to do to protect our customers, what changes we need to make to resume operations. There's going to be a lot of footwork that we're going to have to do and figure out how you're going to protect the employees and customers. What changes do you need to make? Look at your operations. You're going to have to look at your operations and figure out how you're going to be able to function with the changes that have already been put out there. And it's not like things are going to go away anytime soon. There are things that we're going to have to deal with for a little bit now. And hopefully you've made some of those, thought about the processes you're going to have to change in which to get to where you need to be. As an example, we at Hausman Johnson, we put together a team, and I think it's a good idea that you as a business would want to do this, get this out there so that you can create a pandemic response team. you would have different things that people on the team would have responsibility for. Like you'd have your team lead that would get together all the information, get the people together, and figure out what you're going to have to do to go into operations. And this could involve people that are in HR, stakeholders, safety pros, etc., in which this team will make those decisions behind the scenes to try to do this in a seamless way so you can get back to work. The COVID prevention and protocols lead. These people would be responsible for developing protocols and thinking about the well-being of employees, oversee any isolation situations that you might have to get into. Hopefully you've made it clear with putting together your procedures that if someone is sick, they're not feeling well, or they're showing some of the symptoms, that they should just stay home. And I know this could be a difficult thing because, with people being away from the place of business for a long period of time, they might be anxious to get back to work. And I know me personally, I've been throughout my career, no matter what, I would get myself up. If I wasn't feeling good, I would take myself to work. And that's something we have to get away from, because I don't want to infect anybody else. Or if I'm sick, I don't want to have somebody else get sick because of me. And that's just a personal feeling. Some people might feel that same way too. And those are things that you have to think of. And this team would put this together to make sure that if somebody was sick at work, they would be either isolated or sent home. Sanitation and disinfection. Have to make sure that you are getting the workplace clean. And people on this team would do the logistics to go through the daily cleaning, coming up with how you're going to do it. Who's going to be able to clean? Who's going to be able to disinfect the workplace? What you're going to do? Are you going to have some onus on the employees to disinfect for themselves, like if they're at their workstation, to keep their desk clean, their keyboards clean? If they're going to use a copier, making sure they clean that off after each use, because that's going to be something we are going to have to do. And with you having this team together, they can come together and make this plan go seamlessly. And then the one really important thing is communication. This person will be responsible for communicating to everybody to make sure that they are managing any and all pandemic related communications, so that people know. More information people have, the better it's going to be. Maybe getting that out in front of the people before they come back to work is probably going to help out a whole lot, because what we've done at Houseman Johnson, we've reached out to employees to see how they feel, how comfortable they're going to be to get back to work, and thinking of some of the things such as, like if, because their kids are at home and there's no school and there might not be any daycare, how are they going to be able to come back to work? So getting that information from the employees too is going to help out a whole lot. Now, your managers and supervisors, they're the ones that work closely with the employees, and they're going to be the people that are going to have to walk the talk. They're going to be the example that is going to be set for the employees. So if you're going to put forth that you're going to practice social distancing, you're going to have good personal hygiene, those frontline managers and supervisors have to be the ones that are going to have to do that. So they show the employees that, yes, it's not only just because you have to do it, it's because we're going to do it too. Everybody has to do it. And all the employees are going to play a huge role. Why? Because they're the ones that are going to be most affected. If they're working, they're working with coworkers, they're working with clients. It's the best practices that need to be followed. The employees are going to have to follow this. You're going to have to be able to ensure that all your employees are trained in anything that they've been told too. This can go back to the communication portion also. Employees need to know what is going to be expected of them, and the more that it's explained to them, the better off it's going to be. And they're going to have to make sure that if they have any signs and symptoms of COVID-19, we should all by this time know what those signs and symptoms are, such as fever, cough, shortness of breath, etc. If they have body aches, chills, or fatigue, they are going to have to be in touch with themselves and be able to convey to somebody that, okay, I'm having these symptoms, maybe I should not go back to work. I don't want to expose my coworkers to the possible sickness that I do have. We want to try to keep it from spreading. And I know people, like I said, people want to get back to work, and they want to understand that people have to understand that they have to take a step back, think about how they are, and think about how they don't want to expose anybody else to it. Excuse me. And the best practices, I think we've gone through this time and time again since this is first started, is that we got to practice good hygiene, making sure that people are using either soap and water or hand sanitizers. Well, with the hand sanitizers, they have to contain at least 60 to 95% alcohol. And employees should wash their hands for at least 20 seconds with soap and water. We need to avoid touching our face. That's probably one of the hardest things to do, because I think we do it more than we really realize. And maybe this has brought it to the forefront exactly how much you do touch your face in the course of a day. And we got to get away from that. And if someone needs to cough or sneeze, use a tissue or use an arm. Now, one thing I do have to bring up with this is that if somebody coughs and sneezes, and this is a rough time of year, because some people do have allergies and they do cough and they do sneeze, and I just happen to be one of those people that do. And allergy season, it's going to happen. People are going to cough, people are going to sneeze, but they need to communicate that to people around them. And if they do have that coughing and sneezing issue, it's really would be to everybody's benefit if that person did wear a face covering or a mask to cover their mouth, so that reduces the amount that goes out. And also remember to practice social distancing when you come back to work. This may take some doing, but you should look at the way you do business at work and find out if there's any way that you can avoid doing some of the jobs that you do with people around you. Excuse me. We also have to, like in light of what happened yesterday, with the Wisconsin Supreme Court stopping the stay safer at home laws that came out, you have to make sure that you're following what the state and local governments are saying, because just for instance, the Dane County is going to continue with the safer at home so that they're not going to allow some of the businesses to open that would normally be able to open due to what the Supreme Court said. Now, we do have a website that's from the Wisconsin Economic Development Corporation, and they have reopening guidelines there. I would go, if your individual business needs guidelines on what you should do when you're opening, when you reopen, this is a good place to get information. They'll give you general guidelines, and they'll give you industry specific guidelines of what you'll have to do for like agriculture or entertainment or gyms and fitness, hair and nail salons, manufacturing, professional services. They'll give you guidelines of what you should be doing as a business before you reopen. It's a really good site to go to. Been on it a few times, and it can give you good, sound information on what you should be doing. But you have to understand the risk also. Just because you're allowed to reopen, it doesn't mean that there's a magic wand that's going to be waved and there's not going to be any more COVID-19. It's still going to be around, and it's probably going to be around for a while now. And that's why you need to understand what the risk level is, what risk level your employees are going to have, what risk level the public could have. And you can find out what your risk level is by going to the Department of Health and Services, wisconsin.gov, to get information on what the risk level your business is at. And if you just give the business name, county, and your NAICS code, that will give you the information on what your risk level is as a company. And with assessing risk, you got to figure out how likely it is this particular risk is to occur. And what are the ramifications should the risk occur? These are things that the team can help you come up with a good plan, so that just in case, what happens if there's an outbreak at your business? What happens if there's some exposure? What are you going to do? How's it going to affect your business? Consider your potential financial losses, compliance requirements, employee safety, business disruptions. What if you have to close back up again because of this? What if this harms your reputation because you wanted to get out in front and get your business open, and all of a sudden there's exposures and then you have to close back down? How is that going to affect your business? So these are some of the consequences that you have to consider before you open up. And identify the hazards. Where are they? What are the possible exposures to employees and customers? What happens if an infected person enters your facility? Are you monitoring them before they come into your place of business? Are you taking temperatures? Are you scanning? Are you screening? Where are the high-risk areas, such as the bathrooms, break rooms? What are people, like coffee machines, what are people touching on a regular basis? What are you going to do to reduce those areas that could be hazards? This is something that OSHA does with other things too. They want to make sure that you are reducing the hazards, and this is not going to be any different. This is going to be something that they're going to look at you as a company and say, what are you doing to keep your employees from being exposed to this hazard? And in some instances, you might have to modify your workplace. based on social distancing protocols. Making sure you're staying that distance of 6 feet at all times, or at most times. If somebody is passing each other in the hall, that's one thing. You could come up with a policy of, okay, if you're sitting at your desk, you don't have to wear your mask. But if you're traveling through the office area, maybe you'll have to wear a mask. That can be a suggestion that's made. And as many plans as there are out there, you have to do what's best for your company. There's not a one size fits all with these plans. It has to be something that fits your business. It has to be able to adapt to your business, and your business should adapt to something, or you should come up with a plan that fits your business, because there might be some things that you don't do and it doesn't pertain to you. So you might not have to do that. And so, some of the changes include making sure you establish or enforce a crowd control plan to make sure that as few employees are in the building at one time. Maybe you're not having the whole office area or whole business come back at the same time, or maybe you're doing it at different times. You're staggering shifts so that not everybody is there at the same time. That's a possibility of what you have to do. Prohibiting in face-to-face meetings whenever possible, encouraging the use of virtual meetings. And so just like these webinars and meetings that we have as a team, we do it online. We don't do it face-to-face. And limiting the size of in-person gatherings, having less than 10 people in a room. Now, if you have a big conference room or you have a big meeting room in which you can spread people out enough so that you can maintain that social distancing, you'll be able to do that. That wouldn't be a problem. And encouraging employees to avoid sharing workstations or equipment. That goes back to something that we do share in an office setting, is that if you're sharing a copy machine, making sure that's wiped down after every use. Or if for some jobs that you're doing, wearing gloves, but knowing how to properly dispose of these things when they're using them is going to come in really big, because it doesn't do you any good if you're just taking them off any which way, throwing them down on your desk and then picking them back up and using them again. So these are some of the things you have to consider. And staggering meal time, so not everybody's taking their break at the same time. You could also, in that break room, reduce the seating so not that many people can be in there at once. I think I brought this up before: employee scheduling, permitting only essential employees in the office, having people still work remotely if possible, staggering shifts, and having groups of employees that are to work together in shifts throughout the pandemic response. So again, adapting to what your needs are. And before you open, you may want to consider cleaning and disinfecting. And it's really important that you clean first and then you disinfect, as opposed to trying to disinfect on an area that's not clean yet. That will reduce the amount of germs that are there. And when you get into a situation where you are disinfecting, sometimes that has to lay on the surfaces before you wipe it off. So know what you're using, and being able to follow those directions are going to help you out in the long run. And make sure that if you are doing these jobs or these tasks, make sure you're wearing the proper PPE, and disinfect all spaces with an EPA registered disinfectant. If you go on a CDC website, they will let you know exactly what those disinfectants are, and replace your air filters in your place of work. And once your office or building is clean, you want to make sure you work with your pandemic team to go over a daily cleaning schedule. What areas need to be cleaned on a regular basis? And like I said earlier, you have to have the onus of the employees too, that they clean up after themselves in certain situations. Excuse me. And excuse me. Should be screening employees on a regular basis. Temperature scans are not required. It's just something that some businesses are doing. Some construction job sites are doing this. Some small businesses are doing this. But you have to remember that if you're doing this, you want to make sure the identity of the employee is kept secret. So if you have to tell other employees that, oh, one of the employees has come down with COVID symptoms and you were working around a person that day, and there's a possibility of you being exposed to, or there's a possibility you've been exposed to this. But not use, you can explain that to the employees without disclosing the name. And again, getting out ahead of this and letting the employees know that they are going to be screened is going to help out in the long run. But some of the questions that you can ask if you are screening and you don't do temperature scans is like, have you or are you experiencing any symptoms related to COVID-19? Have you been exposed to anybody, or if you've been around anybody, or are you caring for somebody that has symptoms or tested positive for COVID-19? Or have you recently traveled out of state or into a COVID-19 hot zone? That's information that you can use in determining if there's any problems or going to be any problems with possible exposure at your workplace.
So, thank you, Jeff. That was very good. This is Rick Barton for everyone. I was introduced earlier and I took a little break. I decided to get up, walk away from my workstation, grab the handle on a couple doors, and then I did what? What do you think I did after that, everyone? Yes, I did. I probably touched my face without re-sanitizing my hands, and that's exactly what we need to do in order to prevent this from spreading within your workplace. It's a very difficult task we have ahead of us, everyone, and I appreciate everyone coming on to the webinar and listening in. But think about some of the things that we do every day and how they're going to change, and that's what Jeff was alluding to. My task for the rest of the next 20 minutes is to go through the training protocols and the requirements when you do have someone that tests positive. And I think it's very, very important that we understand that we are going to make some significant changes in our workplace for the time being. And maybe down the road, we get back to normal. But Jeff just mentioned we might be doing some screening and we might be taking temperatures. We might have to train someone to take those temperatures and record whether or not they're high or not. And now we have someone that maybe does test positive for COVID-19 because they had a high temperature, or maybe they had the symptoms. So now what do we have to do? That person needs to be self-quarantined. I think everyone understands that the self-quarantine means that you stay at home. You quarantine yourself in your own house away from the other people that may live there. For many of us, we have other people in our households and we don't want to spread it within our household. So we're going to have to self-quarantine. And I think it's our duty to educate people the best we can. There have been many pockets of people throughout the country that were not educated on this, and we have had spreads of this COVID-19. So we need to make sure we understand that. And that means for 14 days, you're not going to receive any visitors at home. You need to wear a face mask if you're around people. And I can tell you that I have personal experience from this, not myself, But I have a daughter who is a pilot in the military, and she got quarantined when she came back right after this started. She had to spend 14 days in her own house in 2 rooms while her husband stayed in another room because she had to come. She came back from Spain right after this started. She did not have COVID. It was just military quarantine. Anyone that comes back is quarantined before they go back to work. It's very, very difficult, but they managed to get through it, and they're all back to work and they're good without any repercussions. But you may have to wear a face mask if you're the one that's ill. Remember, the face mask is to keep us from projecting the virus out, and that's the main reason we wear them, so that we don't infect other people, and then we wear them so that we don't get infected. So avoid using household items that may be used by other people. These are all very important things. So what happens is we need to clean these surfaces regularly, and this is at home and even at work. So, and continue monitoring their systems. So as we flip to the next slide here, you'll see that when we do have someone that needs to is tested and are symptomatic, we have two sets of rules. We have one for the employee that was symptomatic but was not tested. They might have the signs and symptoms, and that's fine, but they are not going to return to work for at least 72 hours once they come down with those signs and symptoms. And that 72 hours it means that their fever is going to come down under that 100-degree mark, and they're going to go 72 hours without any medication to reduce their fever. They're also not going to have the coughs and other symptoms, and they're going to be improved. And there's going to be 7 days that have passed since their first symptom. So it might be a little bit of time before they get back to work. Someone that does test positive, we know we're going to have to quarantine them, but they are not going to come back until they have the fever is gone and the cough and symptoms have improved and they've been tested and they have a negative test for COVID-19. I think these are, again, you go back to what Jeff talked about, putting a plan together. This is what we're trying to aim for, is putting a plan together that will be beneficial for you and your employees as we go through this whole COVID-19 process. And then if we flip to the next slide, we will find that there's other things that we have to think about. Exposure and confirmed illness protocol. If you do have someone that in your facility that is positive, we have to do some contact tracing. Many of you may or may not have ways to monitor who's coming and going from your facility and at what time. Let's say you have an individual that tests positive. They were in your facility on May 14th, today. They spent the whole day there. They find out a couple days from now they're positive. We need to find out where they were, who they worked with, what areas of they go into, and find out who else might be affected and get them tested. And then we also have to clean and disinfect. And I think Jeff hit on a really important point, is that when you clean, you need to put the material on the surface and let it sit for a while so it does kill the virus, and then you can disinfect. You talk to the professional cleaning companies, it's a 2-step process. It's a cleaning process and then a disinfecting process. If you don't clean, the disinfectant doesn't always work the way they want it to. So we need to make sure that we do have a process to make sure that we have these confirmed illnesses and we have a process in place. And these are all outlined in the steps that you will see in the WEDC guidelines, and also a nice guideline that the Wisconsin Safety Council put together. So if we can go to the next slide, we'll find out that what we have is that we have to train. I think one of the areas that everyone on this call probably has employees, they have to train in some manner or way when it comes to safety regulations. This is kind of like the bloodborne pathogens training program that you have, except it's very specific to COVID, and there are some unique things here. So we can't say it's the exact same thing, but we need to make sure that we train on the topics that Jeff already talked about. But more importantly, you need to make sure or get your employees through training as they come back. A couple methods you might want to use. Maybe you want to do the training before they get back. Maybe you can do it virtually, like we're doing right here. Go through some of the stuff. Send out information to your employees. Maybe send out your COVID-19 return to work plan so they understand what they're going to do or going to do. At Hausman Johnson, we're preparing right now to send ours out. Our employees as we get ready to return back to work later this month or early in June. And when we get that out, everyone will know what our pandemic team has come up with in terms of policies and procedures. So think about, what are your guidelines for social distancing? What PPE are you going to have available? And by the way, if you're going to be using PPE as one of your protective measures, you might want to start looking now for the materials. Some of the materials are very limited. So you need to make sure you get those. I think we can get face masks pretty quickly. Face coverings, those are pretty abundant right now. I've got clients that have ordered 1,000 at a time, and they've gotten a pretty good turnaround. But think about that. So as part of your pandemic plan and your return to work plan, you might want to start thinking ahead, because there's only a couple of weeks and we're all going to probably try to get some people back in our facilities and our buildings and go from there. You want to train them on personal hygiene and etiquette, how to do things, as Jeff mentioned. And then who is responsible for cleaning? And that's another good point that we need to keep in mind is, do you have the cleaning materials that are necessary and are going to last through your facility? You might go out and buy 4 gallons of cleaning material, and that only lasts for 3 days. Now what do when it's hard to find this stuff? So we need to think about where we're going to be getting this stuff. And then I would encourage everyone to take a look at the OSHA website and or else the WEDC website and look at the specific plan for your type of business. If you are a retailer, there may be different requirements than there are for a manufacturing facility. A manufacturing facility that only has 20 employees and 100,000 square feet might be a little different than someone that has 200 employees in that same amount of space. So we have to look at what those safety considerations are, and I'll talk about those in just a bit. The last thing we want to think about is making sure we review our workplace policies all the time and make sure they're adequate for our activities. As we move on here, you'll also find out that we got to keep our social distancing. And again, this is the training portion. If you take a look at some of the return to work programs, Houseman Johnson has a template we use. We provide it to some of our customers. There's other ones you can find online. You got to find the one that's going to fit you and do the best for you. But one of the things they talk about, and it's heavily hit, and this is where OSHA is going to come in, is they're going to say, did you train your employees? And one of the training things that we have probably never done is done social distance training. And so I know everyone hears about it. We hear about it on the news. We hear about it here. It's very common right now. But what does that mean in your place of employment? If 2 people are walking down the same aisle, is there enough room for separation, or do we just let them pass? As Jeff said, what does that mean in your break rooms? We have some break rooms. I was in a break room at a facility, and they had put X's on the seats that couldn't be used. And that's how they social distanced themselves. Then we allowed so many people in there, and then they cleaned up after themselves. They avoided jobs that required face-to-face contact. If they had to work close together, they put partitions up. Partitions worked great. So we need to think about those ideas that we have. I used a great change for a handshake. I started golf leagues last week, and we got done after 9 holes. Instead of shaking hands, we all grabbed our drivers and we knocked driver heads together. It's a shake of hands. We tried to do something different. So there's different things we can do. I wouldn't recommend everyone bring drivers into work, but it's something different to think about. And then avoid touching surfaces that have been touched by others. You don't know where they've been, so we want to try to keep that to a minimum. As we jump ahead here, we'll find out that we need to continue to, as Jeff mentioned, avoid those large gatherings. And I think, again, Jeff had mentioned it in a little more detail. I'm going to be very brief here and just say we need to do some training. This needs to be part of our training plan as we bring people back to work. And I would really encourage everyone to look at training everyone that comes back, from your CEO down to the last employee you hired, so that everyone is on the same page. You'd be surprised what people think they can do and still get around these social distancing requirements and keep those in mind. And so, like I said earlier, I bet a lot of us probably got up, like most people do during a webinar where they're listening in. They got up, they moved around, they touched something, they came, they sat back down, or doing something, and what they do, they touch their face. And it's hard because we touch our face a lot. It's very, very natural. So as we move on, we'll also see that in addition to social gatherings, we got to think about the personal protective equipment we have, which every facility may use different type of personal protective equipment, but I think we really are looking at the things like gloves, different types of gloves for different operations. Keep in mind that the gloves have to be donned and doffed properly. You want to take them off so that you're not spreading the virus. I've read some articles where people leave gloves around and the gloves get infected by a virus and they become a haven for transmission. You know, the good thing is that the virus isn't going to live forever on those gloves. So if they are left alone for, over a weekend, they're probably going to be fine when they come back, but we still want to clean them. It's a hygiene issue. Face shields, we could use those for jobs that we have to work close together. You see that in hospitals a lot. Anytime you have close contact with people, you might need to wear that. If you're in the, maybe a dentist or something like that, you might have to think about what you're going to be doing. Maybe you've been doing it already. Face masks, they're not respirators, they're just face masks. They're not an N95. We want to save that for our medical people who are in close contact with people that really do or do have the virus for sure. And eye protection. So you might wear a pair of safety glasses or a pair of glasses in addition to your face mask because we can get this virus in our eyes. So again, the reason I bring this up is we're going to train people, but also, do you have these in stock for all your employees that are going to need them? So as we transition here, we're going to find out that we need to move the slide a little bit. We have a little technical difficulty, everyone. We lost control of the slides, and I put Cassie in charge of that. So we need to move the slide. Now it's all right. Did we lose our slide mover? Our answer? Not sure if we did or not, but I can transition this, and without using the slides, I can talk about a few of the other things that we're going to need in our training program. In addition to this, we're also going to have to talk about the cleaning and disinfecting that we're going to do, who's going to be in charge of it, and we're going to want to train those people. So what I would probably suggest is that everyone take a look at your pandemic return to work program and put that team together. Take the critical people from critical departments, get them together and do it as a team. It's worked great for many organizations that Jeff and I have worked with over the last 9 weeks, and it gives people some input. But I would want to do that, and then I would go through, and once you develop that team, you need to think about your policies on how you're going to isolate those sick people. After you figure out how you're going to do that, you're going to want to obtain that personal protective equipment and the cleaning materials. I think that is very, very important. And the reason I say that is because there are some limited supplies of some of these materials. I was just, and Jeff was too, we had a group of people that were looking for masks and they couldn't find any. Figure out how you're going to clean and disinfect, determine the risk of COVID in your facility. You can either determine if you're high, medium, or low. Obviously, healthcare, meat packing might be a little higher than maybe somebody working in a small retail operation, or maybe a light manufacturing operation. So I think it's important that we do make sure that we have this in place. Finally, you want to make sure you implement the proper engineering controls, administrative controls, and things of that nature, along with training. And then finally, and I think the most important part of your whole program is going to be making sure that you review this program and make any changes. I think once you get everyone back to work, we're all going to make changes to our program. And that could be an issue. Not an issue, but something that we want to address and address it properly. So with that in mind, I will turn it back. Well, I'm going to wrap this thing up by saying a couple of final words here. And that is, if you don't have a plan already, which I'm assuming most of us do, or some semblance of it, take a look at it and make sure it's going to be something that's going to work for you. I would really encourage that you get this plan out to your employees before they return to work so they know what they're prepared for. I've talked to employers around the state, and some of them, they have people that have been working at home for a while, and they're afraid to come back to work because they're not sure what to expect. And I think we need to put them at ease. So I think that'll be important as we go forward and deal with this whole COVID-19 return to work process. So with that, what I would like to do now is turn it over to Cassie because she is going to field any questions. We got about 10 minutes left. If there are any questions or anyone's got any information they want that maybe we didn't cover, please let us know. You can see on the back of the last slide here, it's got our email addresses, so feel free to send either Jeff or I any emails, and we will be more than happy to provide you guys with any assistance we can. I guess our main goal is to try to get everyone back to work as safe as possible and as quickly as possible with reason. And like Jeff said, we may have a reoccurrence and some businesses might have to re-shut down. So Cassie, anything on the question board?
Yes, it looks like we've had quite a few questions come in. And just to reiterate, you can put a question in the question handbar in the GoToWebinar, and Rick and Jeff will address it at this time. We'll try and get through as many questions as possible. So I will start with our first one. Do you recommend having employees sign an acknowledgement that they will abide by your new guidelines?
I'll take this one, Jeff. This is my thought on it. This is the same as your lockout tagout program, your emergency evacuation program. When you train them, they're going to sign in for that training, or you're going to get documents that say they've gone through the training. And I think it's like any other safety policy. It's a safety policy. If you've trained them on it and they know that they have to do something, I don't know that you really have to go and sign anything and acknowledge that they have to be abide by these rules. I think you need to let them know about these rules so they know what they're in for when they come back. I think that's really important. Jeff, you got anything to add to that?
No, I think you've covered it. Just making sure that the employees understand it, and that could just be something that you discuss with your HR department to make sure that the understanding with the employees is clear and that they know what the policies are going to be, and they're expected to abide by those policies.
That's correct.
All right, our next question is, can any employee be identified to do the daily screening?
I'll take this one. This is a difficult one because I don't think that you can force anyone to do the screenings, but you can train somebody. If they want to volunteer to do this, you have to make sure that they're trained how to use use the equipment properly, and then you have to make sure they have the proper PPE when they're doing this. And that could mean wearing gloves, wearing a mask, wearing a face shield on top of the mask also, because what happens if you get into a situation where someone isn't feeling good, or all of a sudden they have that sneeze come on and they do sneeze, and that person that's doing the screening is not protected, they're going to be exposed. So with that, if they have that face shield as an extra barrier in front of them, that's going to help to protect them. And if you're doing the temperature scans, you make sure it's an infrared scanner, that you don't have to come in contact with the person's forehead. You can do this from a distance, and hopefully it's one that the distance is going to still give you an accurate reading. It's all on the equipment that you get also.
Yep. There is one other thing I'll add to this. I have heard that there are services that will come in, train nurses, things like that, that will come in and do this for you. Obviously, That's not always needed, but some people feel that's an added benefit if they want to go that route.
All right, our next question is, if an employee is found positive for COVID-19, you mentioned that anyone in contact with them in the last several days should be tested. Who pays for that, the employer or employee?
At this point, there's no cost for a COVID test, so I don't think that's, we have to worry too much about that. All the COVID tests have been free of charge as far as I'm aware of. So I think we're okay with that. But if we ever did have to pay for it, that's a question I probably couldn't answer right now, but most likely it's going to be the employer.
All right. Next question is, can we make an employee go home if they are experiencing COVID-19 symptoms?
Well, to answer that simply is that you are protecting all of your employees. So if there is somebody that's experiencing those symptoms, yes, it's your right and it's your duty to send them home so that it reduces the spread of the disease.
So in your pandemic or your return to work program and policy, you're probably going to have a phrase in there. If someone does come in with those symptoms or they're testing positive for 100 degrees or higher, you're going to have a process. Maybe that is to get your HR person involved, or that person can make that decision that's doing the testing. Sometimes HR or someone of that nature does the testing, so they can make that decision right there.
All right, next question is, how do we document if an employee refuses to follow safety protocol?
I'm going to take this one, Jeff, because I think it goes back to the very first question we had. If you do have a plan and you do have a program in place and you've done the training, I think you document any discrepancies or violations, if you want to call them that, the same way you would document someone that didn't wear a seatbelt when he was driving a forklift or any other safety activity. Because I consider this the same as any type of safety issue. So we've got to document the same way. You know, obviously every company is going to have a different process, but you know, maybe it's a verbal and a written. They might even get laid off for a little bit of time if they're not following protocols. But keep in mind, I think this is a sensitive issue. So I think sometimes we just need to do a little counseling too with employees. And this isn't something that's been around very long. So we're going to have to learn and try a little bit. And I know that sounds a little wishy-washy, but I think every organization that's listening in right now, you're going to have to do some trial and error on this. But if you do feel you need to discipline people, that would have to follow your same safety protocols.
All right. Last call for any questions, if there is anyone who would like to submit one.
I have a question for the audience. How many people touched their faces in the last 5 minutes? I bet you almost every one of us did, and it's hard not to.
Guilty.
But, you know, hopefully your hands were clean because you just sanitized. Obviously, that's really tough. Think about it when you go to the grocery store. You know, touch all that stuff, you know, and then you forget you don't sanitize your hands, and all of a sudden you got to rub your eye because you got something in your eye. Yeah. Sanitizer in the car this time. Shoot.
Well,
If we don't, go ahead.
Oh, if no one else has any questions, I was just going to wrap it up. You go right ahead, Rick.
Nope, I was just going to say the same thing. If no one has any other questions, Cassie, you can finish it up.
All right, well, we just want to thank everyone again for attending today's webinar. If you would like to, we'd really appreciate if you filled out the short survey at the end, because your feedback is extremely important to us. It helps us decide how to do more webinar topics that people find important and for us to get that information out to you. We will have some webinars released shortly, so the recording will be available to you as well as the email. So we want to thank you again and have a great rest of your afternoon.
Thank you, everybody.
Thanks, everyone. Appreciate you calling.